Hi, welcome to today's videocast. So today I have taken up the subject of a very important specific learning difference or specific learning disability, that is dyscalculia. So just if we want to broadly speak about it, we say there is some problem with the individual or with the child that he cannot do mathematical or she cannot do mathematical operation. But dyscalculia are of many types. So that's how I'm going to begin this videocast. What is dyscalculia? It's a term referring to wide range of difficulties associated with numeracy, associated with mathematics. It is rarely identified, and again, it's a specific learning disorder difference. So it's a learning difference. It's a neurodiverse mind. And I would also like to bring into your awareness, like we respect different kind of bodies, we need to respect different kind of mind. So what all can dyscalculia include, or what all a person who is suspected to have dyscalculia would face difficulty in? There would be difficulty with understanding the relationship and magnitude of numbers, then effectively doing counting strategies like counting backwards would be a difficult job. Identification and fluency of numbers would again be a trouble. Mathematical operations, definitely addition, subtractions, divisions, multiplications, that would be a difficulty. Now, the working memory capacity would not be that great associated with mathematical operations. So, working memory is immediately somebody is giving you like instructions related to mathematics, and you will not be able to process it or perform it so well. So, working memory capacity associated with mathematics would be a problem. There would be a poor sense of estimation related to mathematics, not overall in life. Then difficulty to visualize the mathematics pattern, that would be again a trouble. So the child or the individual would not be able to move from basic mathematics to advanced mathematics like factors or exponents or solve algebraic equations or different kind of quadratic equations. Now comprehending word problems would also be not easy. Skip counting would also be again difficult. As I said, that counting strategies would be difficult to go with. And all this would lead to high level of mathematics anxiety, which in my time teachers would never get it. So now teachers are aware that there is a thing called dyscalculia, but back into my times, there would be high level of anxiety associated with mathematics, which maybe the professional would also not get it at that time. So this is an important clinical presentation of dyscalculia, that the person would have high level of anxiety associated with mathematical operations. Well, I still do. Now, research says that 30% of ADHD, people who have ADHD, they have dyscalculia, again because their working memory associated with mathematics and numbers is not helping them to perform well. Now, commonly, again, research is saying commonly that 5 to 7% of school aged children, that is from 6 to 12 years, like middle childhood, would again have dyscalculia, and the frequency of occurrence in both the genders, whether it's a male or a female, would be equal. So it's not like boys are affected more or girls are affected less. That's not the case. That's not here in this case. Now, impact of dyscalculia does not stop when the mathematics class ends. So it will not be just limited to your maths class session. It can go beyond or outside school. Now, how does that get affected and how is that impacted? See, remembering numbers, zip codes, postcodes, telephone numbers, phone numbers would be again difficult too. Then money matters, especially counting bills, how you're splitting the bills, how are you doing that contribution in the bill amount, that would be not great to understand, not able to easily be comprehended by a person who is having dyscalculia. Length of the distance, they would understand, okay, these many minutes would be taking place for the distance to be under this much distance to be covered. But these many kilometers, if you say, oh, it's just a 2 kilometers away of a distance, that would not be a great idea to suggest a person who has dyscalculia. But if you say it will take 10 minutes, maybe that person understands it better. Then left and right, again, there could be confusions. Sometimes they would guess it right, or sometimes it would not be. So, correctly answered. Then reading a clock and telling the time, especially the needles one, that would also be difficult for some. Then remembering the directions, too many directions, oh, it's too much for my brain. So, that would be the reaction. Now, how does dyscalculia diagnosis take place? Who can diagnose? How do we get to know about this? Is, see, teachers keep on noting what learning area in mathematics is getting affected, like skip counting is getting affected, word problem is getting affected, or writing the steps, formulating the steps, or what is getting affected. So teachers play a very important role. Okay, then doctors can actually rule out if the child or the individual is having any hearing or vision impairment. See, it could be a visual processing disorder separately, or it could be an auditory processing disorder separately, or just a hearing impairment. So it needs to be ruled out so that you can come to a correct diagnosis. Now, a learning or education consultant, they can do a proper assessment, they can prepare their worksheets, and they can do a standardized assessment. Then they can advocate these strategies regarding visual processing, short term memory, the long term memory, the language, how to build strategies across calculation, quantifications, building up strategies on the skills of memorizations and visualizations. So this can be done by an education consultant or an educational professional, or like somebody who is dealing with the neurodiverse world. Now, very important note to take here is that yes, you can be born with it, because there is a certain difference in the brain area, or you can get it later in life. Then it would be called as acquired dyscalculia. So that could happen because of a brain damage or brain lesion. You can read about it. See, dyscalculia can result into a mental health issue because there is a pressure to perform mathematics. So that so then the child can have self-esteem issues, which would result into getting anxiety and depression, because other people, the world around us, the school people around us are going to approach it like it's a weakness. It's a weakness in the child, but actually it's a different brain, because it does not affect the intelligence of the child. They do have average IQ scores. Okay, research says that. I am not saying, research says that. And above that, they would be great at certain creative skills. They would be having better problem solving skills than their peers. So it would not affect the overall intelligence. It can just affect the working memory associated with numbers and mathematics. So that is what I want you to remember. So this is about it for dyscalculia, and I hope you have understood it well by this video cast. So stay tuned and stay glued, and I'll be coming with more on a different topic very, very soon. Thank you. Bye.